Hi, Shelley. How are you today?
I'm doing well. How are you?
Very good. Thank you so much
Good.
for your time today and for allowing me to record this portion of the interview.
And thank
So,
you.
I understand that you have 9 years of medical experience.
I do. I do.
Okay. And you were at Halifax and Alliance Care?
Yes, I was.
Okay. And what is Alliance Care?
Alliance is a specialty surgical center where they do pain management.
Oh,
So
okay.
I worked in the clinical part um, of Alliance, and I would call the patients and gather all the information, including their medications, their health history, surgeries, anything that pertained to the upcoming procedure that they were having done.
Okay.
Then we
Great.
would go through and schedule for them, what would be perfect or work well with them. I was dealing with 8 different doctors at that time. So each doctor had a different day that they were there. So that was one thing that you really had to focus on was paying attention to and making sure that you were scheduling on the right day for the right doctor at the right time.
Okay. Absolutely. So, be organized,
Yes,
detailed, I would imagine,
yes,
and definitely being able to multitask, I would think.
yes,
In that
definitely.
type of role. And then you also worked for Halifax. Was that for the hospital?
It was for their outpatient oncology.
Okay.
I
Okay.
did, actually, it was both. It was oncology. Uh, I was worked hand in hand with the doctors. I did the patients' first assessments when they would come in, their vital signs, updating their medications, gathering any new problems that they might be having. And then when I would take them back to the doctors and I would go over things with the doctor as to what I found. And so that was kind of like the medical or the oncology part.
Okay.
Plus, I would make sure that all the rooms were stocked and all the supplies were ordered and that they
So,
had.
oh, I'm sorry. I was going to say, in that position, were you handling medical records and medical terminology?
Yes, yes.
Okay. Um, and then, of course, HIPAA. Uh, I'm sure in all of your positions over the 9 years. Tell me about your computer skills.
Well, I would say I'm good. I'm proficient.
Okay.
Um, you got to remember, computers. I wasn't. They weren't around when I was growing up, so I actually had to go and do a computer class when I was younger.
Okay.
So I can maneuver my way around pretty well.
Okay. So Microsoft Office, are you familiar with that and Excel, like to do data entry if needed?
Yes, and
Okay.
Word.
And I assume you did, what did you work with Epic at Halifax? Is that what they use?
Um, you know what? I can't remember, and I don't think it was Epic at that time.
Okay.
I could be wrong, but I don't think that was it because that doesn't ring a bell to me.
Okay. And then we talked a little bit about that you had a brief gap in your employment during that time you were caring for your mom, who was ill at the time, but you did keep current with some trainings and certifications during that time lapse.
Correct.
That's super important that you were, on the computer doing those trainings as needed, to keep all your skills sharp.
Yeah.
And as far as we talked about a couple different positions, and you did a lot of scheduling throughout your career. So we chatted about that being your first choice in a
Correct.
position. Is that correct? Okay.
Correct.
So the
Correct.
scheduling position and maybe a medical records would also
Yeah.
be something you'd be certainly experienced in. How do you feel about phone calls, answering calls and
I don't have
such?
a problem with that. I'm used to that,
Okay.
working in the past. And then when I was a bank manager years ago, I was always on the phone.
Sure. Absolutely. Okay, and we did chat a little bit about professionalism in the office and, there to work. So I know that that would not be an issue with you. We talked about that pretty in depth. Let's see here. I think that's about it that I need for this portion of the interview. So I'm going to go ahead and stop the recording, but don't hang up. I'll be right back.
All right, I will.